Hi, new nursing students. My name is Melanie Teitzma, and I am a nursing student entering my third year of nursing, and I'm here to talk to you about what nursing means to me. When I started nursing, I didn't really have a specific conversion story. I know a lot of my friends, and probably many of you as well, have had some event happen in their life that made them want to choose nursing, often because family or friends ended up in the hospital and you want to make a difference in people's lives just like the nurses made a difference in your friend or family's life. I, however, chose it because I love helping people and I was pretty academically successful at the time, so I figured why not. However, everything changed for me in my first semester. I ended up having 4 of my friends end up in the hospital at 4 different times, and it was a really rough season of my life for sure. And I remember what it felt like to be the people waiting on the outside while nurses were on the inside trying to save my friends' lives. And it was awful. I remember the different kind of reactions I would have and how I was so frustrated that I couldn't help my friends at the time when they needed it most. Especially since I was already in the nursing program, I thought that I should be the one being able to help them and how this shouldn't have happened to them. For me, it was a difficult situation, but of course for the families it was even harder. And so when I was waiting with the families, we would try to comfort each other. But the best thing that happened to us was whenever a nurse would come by, stop, talk to us, and say that they're trying their best to keep our friends, my friends, their family alive. And they would never give us false hope, you know? They would never say that everything was going to be okay, but they would tell us that they were trying hard. And that was kind of when I realized what nursing really means to me. Nurses get to see people at their worst, not just the patients that you're working with, but also the families and the friends. You get to see people in probably one of the most painful times in their lives. And nursing is a very difficult job that way, where you are really faced with people when they are at their worst, and we don't really get to know people when they're at their best. For me, when I'm a nurse, I hope to reach out to all of my patients and their families in a way that will leave a positive impact on them. Even taking that couple minutes to stop by, give them a quick update on what we're doing, because I know what it's like to wait and hear waiting to hear what exactly is happening to my friends that I really care about. And yeah, for nursing, that's something I really want to do. And on the other side, now that I've had my clinicals and I'm actually working as a healthcare aide, I have realized that patients have made a really big impact on me as well. And so it's not just a one-way relationship where, yes, we should hopefully be making a positive impact on our patients, but also they're going to make an impact on us, and sometimes you're going to be remembering them until years after you actually worked with them. So to conclude what nursing means to me, nurses, we get to see ourselves helping people in their darkest times, and we get to reach out to families when they're at their worst. I think that that's a beautiful thing, and it's a difficult job, but it's totally worth it because it's something that will make a difference in their lives and a difference in your life. And I'm sure many of us know what it's like to be on the other side of that. When you're not the nurse, you're the person waiting for the updates. Now, I'm not telling you guys that a lot of your friends are going to end up in the hospital now that you're in nursing. Certainly not. But it is important to remember what it's like to be the patient, to be the family, to be the friends, and what kind of impact you're making on them. And that nurses have the opportunity to make such a huge impact. And that's something that my friends who are in the hospital, they still talk about to this day, about how important nurses were to them and how they felt like they were being cared for because nurses would be there and always working, always taking time to stop by. And I think that's something that we can all do as nurses as well. So in conclusion, I really hope that you guys all grow to become great nurses and that you're able to take the time to be with your patients, learn about their families and their friends, and understand that they're in a really difficult spot right now, but you're here to help. And yeah, I think that's about it. Thank you.